Good morning, everybody, and good afternoon, good evening. We are waiting for Dr. Esselstyn. He will be joining us shortly. Just want to let everybody know to stay online. He will be with us shortly.
It's Esselstyn.
Esselstyn. Thank you, Anne. Thank you, Dr. Anne. Esselstyn.
Yes. Okay. They can see you. They can see you. You're fine.
My glasses are upstairs. Good morning.
Good morning, Doctor. How are you?
How are you?
Not bad at all. So we have a live audience today. They're looking forward to speaking with you. Let me do a quick introduction, and then we'll sort of begin our discussion if you don't mind. Is that okay with you?
Yeah.
Wonderful. So let me just introduce you. Good morning, good afternoon, and good evening to those of you who are joining us from across the world today for another edition of Putting the Planet on a Pandemic Diet. We are delighted, honored to have Dr. Caldwell Esselstyn, a renowned physician, an Olympic gold medalist, and a Bronze Star recipient with us today. Dr. Esselstyn has been associated with the Cleveland Clinic since 1968. During that time, he has served as president of the staff and as a member of the board of governors. He chaired the clinic's breast cancer task force and headed its section of thyroid and parathyroid surgery. He's also a fellow of the American College of Cardiology. He has over 150 scientific publications. In 1995, he published his benchmark long-term nutritional research arresting and reversing coronary artery disease in severely ill patients. That same study was updated at 12 years and reviewed beyond 20 years in his book, Prevent and Reverse Heart Disease, making it one of the longest longitudinal studies of its type. Dr. Esselstyn is presently directs the Cardiovascular Prevention and Reversal Program at the Cleveland Clinic Wellness Institute. Welcome to Pandemic Punditry, Dr. Esselstyn.
Thank you.
And I hope I pronounced your name correctly there. I may have murdered that a bit.
You wouldn't be the first.
I have the same problem with my last name sometimes too. So, how do I actually say that so I don't make that mistake again?
Well, it's Esselstyn.
Esselstyn. Okay, Styn. Okay, Dr. Esselstyn. So what we wanted to sort of do is to sort of have a freewheeling discussion around the subjects that you're mostly familiar with, and we also have a live audience, so they may ask some questions, and we'll moderate that and ask those questions when they do have them. So if you're part of the audience, feel free to sort of ask your questions, and we will pass them along to Dr. Esselstyn to answer. So Dr. Esselstyn, maybe I start with this question. I think the pandemic has made millions of people across the globe aware of this term called comorbidities, right? Everybody sort of heard about this concept of having a comorbidity, and especially cardiovascular disease and diabetes. So do you believe that this heightened awareness could be a silver lining for physicians such as yourself who have been advocating lifestyle changes for several decades now?
We'll have to wait and see. It seems logical because these comorbidities increasingly seem to have to do with the same vulnerable cell that is at risk when we have heart disease, namely the endothelial cell. And the virus seems to really pounce on the endothelial cell. And if the endothelial cell population in our bodies is compromised by the food that we've been eating, then it's these same vulnerable souls who get COVID-19 because they are depleted in a sort of a defense mechanism of a hardy system of endothelial cells.
That's very interesting, because we had Dr. Colin Campbell on earlier in the month, and he was asking me a question in reverse. He said because he was very interested in the fact that India, where I'm from, has, despite high numbers of COVID cases, have a very low morbidity rate, and he was wondering whether diet had an impact on that rate. So it's interesting that you brought up this connection between the endothelial layer and cells and maybe morbidity. So maybe there is a connection between COVID and your diet, it seems.
Well, when I was in India in 2000, and I was lecturing in multiple cities at Hyderabad, Pondicherry, Mumbai, Calcutta, New Delhi, I was not at all impressed with the diet in India, which I thought was really quite horrible for with all the oil, all the meat. There was an absolute epidemic of cardiovascular disease in India. I bet it's still there.
Yes, I think I think I lost your audio for a second, Dr. Esselstyn. But
and when people from India move to this country, they seem to be much more vulnerable for our coronary artery disease.
Karthika, I'm sure you have some questions as well.
Yeah, Dr. Esselstyn, thank you for joining us today. For the sake of our audience, can you tell us what exactly is cardiovascular disease? I mean, are there degrees to the disease? How does one know where they are in that spectrum?
I missed that last part. What was the...
Are there degrees to cardiovascular disease? What is cardiovascular disease?
Wait a minute. Did you say, are there degrees of cardiovascular disease? Is that what I heard?
Correct.
All right. Well, I think there you're talking about the onset. Let's just chat about that for a minute. We know from the studies of our battle casualties in Korea that an average of 80% of these average 20-year-olds already had Oxide. Those 7 without a microscope for their cardiac events. And that study was then repeated 45 years later, 1999. This time,
Doctor, your audio is a little low. I don't know why that is. It's cutting in and out. I think maybe is your hand covering the mic or anything like that?
my hands are down here.
Oh, wait. Okay, now it's fine. It's just maybe the angle or something like that. It's perfect now. Sorry, we lost a little bit of that conversation. I remember you saying 45 years ago in Korea or wherever you were posted, I think.
Well, no, I was saying that in 25 in 19 let's see, it was the original study was done on the battle casualties in Korea.
Korea, okay.
Where roughly 80% of those 20-year-olds already had gross evidence of coronary artery disease that you could see without a microscope. Not enough for their cardiac events yet, but that study was then repeated 45 years later, this time looking at young women and men who have died between the ages of 17 and 34, who have died of accidents, homicides, and suicide. Now the disease is ubiquitous. You graduate from high school in this country, you get a diploma, and you also get the foundation of cardiovascular. There's no great surprise in the same way. Now by the late 40s, early 50s, we begin seeing this tsunami of cardiovascular disease. So, yes, there are different weeks of cardiovascular disease. Age and the intensity, but obviously there was a paper by Lou Peller, who was the Peller was the let's see, the professor of public health at the University.
Now we can hear you again. So you were saying 45 years later, when the study was redone on people who had accidents, you saw more of the same study that was done on the Korean battle casualties.
Oh yeah, it was 80% in the Korean battlefield. Now it's ubiquitous. Everybody's
got it. Okay. So the point I think is that what you're saying is that when we ask you about this whole idea of a spectrum, that at very, very early ages itself, maybe and we'll get to that point whether it's diet or not. You've seen people having visible. I mean, when you do a dissection, you can actually see the coronary artery disease impacting them as young as 18, 20-year-olds from the naked eye, right? So this is
Well,
something.
even if, sadly, even if those children die at age 12, you can see the early fatty streaking.
Oh wow!
Yeah.
Okay. Wow. Wow. So this concept of sort of this cardiovascular disease that that can strike or start from a very young age. What do you think is the sort of the primary cause of that? I know what your answer is going to be, but for the benefit of our audience, why do you think that people start manifesting these symptoms that early in their life?
Well, the injury, you have to boil this down to two very fundamental molecules. All experts would agree that where this disease seems to have its inception, its onset, its beginning, is when we like that in the guardian of our blood, see that delicate innermost line of the artery called the endothelium. The endothelium is really quite remarkable. You have to be the largest organ of the body. If you were to spread out the endothelium, one single layer thick, it would be 13 square. And the endothelium is remarkable because of the magic molecule of gas that it produces called nitric oxide. And it is nitric oxide that is responsible for the salvation and the protection of all of our blood vessels because of its remarkable functions.
So the endothelial system seems to be a really core component. Why is it that Dr. Esselstyn, that we don't hear about that too often when people talk about cardiovascular disease? I mean, it's like not something your doctor mentions. Is that because there's not really a test around that, or is the focus on something else entirely, like cholesterol, where most people seem to be focusing on as a number? Because I mean, I know you made a lot of talks around this. You've written about this being a very key component of cardiovascular disease. I'm just wondering why other physicians and cardiologists don't talk about this more openly or more frequently.
Well, let's be fair to my cardiovascular colleagues. How much training do they ever get in medical school about nutrition?
Not very much, is my understanding.
Practically zero. How much training do they get about nutrition in their postgraduate training? Practically zero. Matter of fact, it was 5 years ago when I was invited to become a member of the American College of Cardiology. Why? They wanted me to join their nutrition committee. Why? Because our job is to try to educate cardiologists about the causation of the illness that they have been designated to treat.
Wow.
In other words, it's hard to carry on a conversation about endothelial cells and nitric oxide if you've never really studied it.
Okay. So, Karthik, I think you had a question for Dr. Esselstyn.
Dr. Esselstyn, you can hear me very well, I hope. I was really interested to understand the list of diseases that can be prevented or reversed with a whole food plant-based diet.
Yeah, that's an excellent question. We feel that probably a whole food plant-based nutrition is one of the most wonderful gifts that medicine has ever had in their toolbox. Not only does whole food plant-based nutrition have the ability to halt cardiovascular, it's the same for diabetes.
Sorry, doctor. I think you're cutting out just a bit again.
Hypertension. Yeah, I don't think I've moved my head.
Yeah, I know what that is about. Yeah. Go ahead.
Take a look
is it hypertension, diabetes?
Yeah. Hypertension. Can you hear me?
Yeah, much better.
Much better.
Hypertension, diabetes, vascular dementia, strokes, perhaps even Alzheimer's disease, ulcerative colitis, Crohn's disease, rheumatoid arthritis, lupus, multiple sclerosis, allergies, asthma, and the list goes on. It's really quite profound, and it's so safe, and it's so inexpensive. The benefits endure.
Wow. I mean, that's a pretty exhaustive list. I think I've heard you mention before that about 80% of all chronic diseases can be either reversed or prevented or reduced in terms of a whole food plant-based diet. Is that correct? That number, 80%?
That's a good one.
Okay. All right. So I want to throw another set of numbers at you, Dr. Sin, and this is from sort of our part of the world, India and China in particular. I know that you've been pretty harsh on what you've called sort of the American or Western European diet in terms of what it contains. But what we're seeing here in this part of the world, and these are 2016 numbers, so they're a little old, but I think that was the last year that they did the comprehensive study. That 30% of Indians now die from cardiovascular disease, and that number is actually quite staggering. In China, same year, it's 45%, and both those numbers are on the up. So we have 30% of the Indians dying of cardiovascular, 45% of the Chinese dying of cardiovascular, and so what do you think? What do you suspect? Is it diet that you suspect to be at the root of these numbers?
Oh yeah, unquestionably.
And another little data point for you to sort of think that may pertain to India, that does pertain to India, is that India is the largest producer and consumer of dairy products in the world. And we have, both Karthik and I are plant-based, and we in our diets. So we have constant battles with people who claim that no, dairy is something that people in India have been having for thousands of years. It never killed my grandmother. How come it's doing that today?
Well, in addition to the dairy, there are a lot of people in India are eating meat. They almost all are eating oil.
That's right.
And all of those do what? They all injure the endothelial system. Remember that this. Let's just take a moment on what the endothelial system does. Remember when I spoke a few minutes ago that the endothelial system is responsible for making the magic gas, nitric oxide, which is the salvation and the protection of all of our blood vessels because of its magic functions. What are the functions of nitric oxide? All the cellular elements within our bloodstream flowing smoothly like Teflon, things from getting sticky. Number two, nitric oxide is the strongest blood in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed, protect us from getting high blood pressure or hypertension. Number four is the absolute key. Safe and nitric oxide will protect us all from the body any blockages or plaques.
Sorry, Dr. Esselstyn, just again you cut off there. You said when you climb stairs, it's like the Teflon, right? It keeps the blood flowing up in through your system. What was the comment that followed that? Just so that we catch up.
When you climb stairs, it is the strongest, since nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect us from getting high blood pressure or hypertension. Number four is the absolute key.
Number four is absolutely key. Okay.
A safe and normal amount of nitric oxide will protect us all from developing blockages or plaques. So literally, whether you're from London, Berlin, Chicago, New York, or Louisiana, if you develop cardiovascular disease, it is because in the previous decades you have so sufficiently trashed, injured, compromised, and turned your endothelial system And once you get patients never, never, ever again pass through their lips and still more so, it's going to further destroy already train wrecked endothelium.
So, Dr. Esselstyn, I'm
And-
losing you again,
and-
but I think what you were saying is that if once you sort of protect your endothelial level, it's like a bulletproof vest, right? You protect your heart forever. Is that what you were trying to say? You just cut out there again for a minute. I think it's the internet connection that may be dropping in and out a little bit on your side. But I'm sorry I had to keep doing that for you. But I don't want you to get too ahead of our audience as well. So if you could just repeat that last part, we'll be fine.
Well, number 4, nitric oxide in a normal amount will save us all from ever developing blockages or plaque.
Right.
And therefore, literally, everybody on the planet Earth who has cardiovascular disease has their disease because they have so sufficiently, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into a train wreck that they no longer have enough nitric oxide left to protect themselves from making blockages and plaque. But the good news is this.
So, Dr. Esselstyn, if they made it a train wreck in the decades preceding, sort of, the build up to this thing, so is it just? I mean, if they just stick to a diet that you recommend, the whole food plant-based diet, they need to add exercise to that, or is that in its own right good enough?
Well, in patients who are severely sick and they can't exercise, yes, we have seen tremendous benefit. But obviously, exercise is a bit of a bonus. But you can exercise till you're blue in the face without making any improvement at all. You've got that the key. The key is the nutrition of the endothelial cell and nitrogen.
Okay, so that's a key point. I think many often I think people use this exercise, say I work out, and they use the word I eat clean.
No.
Yeah, but it's clearly that's not the answer, right?
One of the most frequent phone calls I get is, Dr. Esselstyn, I have no reason to call you. I have, ever since I left high school, I've been going to the gym 5 days a week, and here they are at 55 and they've had a heart attack. Well, that's actually, you cannot with exercise, you cannot salvage the injury to the endothelial system.
And so I guess some people are asking the question, I'm hoping they're asking the question, given the wonderful information that you're sharing. One is the endothelial system, the nitric oxide that you're talking about, is that easy to generate simply by adopting a whole food plant-based diet, and just as easy to sort of deplete if you take something that's very bad for you, like a slab of bacon or a juicy steak? Is it that sensitive to sort of a meal that you have, or is this something that you have to take for 10 years and then it kills you?
No, I think that there's a wonderful study that was done by Robert Vogel, who was chairman of cardiology at the University of Maryland, where he took a healthy group of young subjects, divided them in half, and they went to a certain fast food restaurant that is characterized by arches, which are golden. Now, half of them got the cornflakes, and then they had the brachial artery tourniquet test, which is a test for the endothelial production of nitric oxide. And those that had the cornflakes, that was normal.
So sorry, Dr. Esselstyn. So half of them had cornflakes first, and then took the test. Is that correct? The order?
Yes.
Okay, great. And then
the other group had the hash browns and sausage.
Okay.
And within 120 minutes, the group that was eating the hash browns and sausage, 120 minutes after that meal, when they tested for the brachial artery tourniquet test, the test for nitric oxide production, it had completely stopped. That single meal had so injured, so compromised their endothelial production of nitric oxide, they were unable to simply
So it completely stopped. We're talking about a block
Yeah,
almost,
yeah,
right? I mean, this is
yeah,
not
yeah.
this is not reduction in function. This is actually a stop, a full stop.
Well,
Wow.
when it was, I'm no, there were obviously going to be some that had a little,
Something going,
a
but a
little bit.
significant
But
block.
the point to be made is they absolutely, that group totally failed the brachial artery tourniquet test. Now,
Wow.
as they followed them into the later afternoon and early evening, since they were young, they began to recover, right?
Right.
But the next morning for breakfast, it'll be scrambled eggs and bacon. Lunchtime, it might be white bread with cold cuts and mayonnaise. Supper time, it might be a baked potato with sour cream, vegetables soaked in butter, lamb chops, ranch dressing on a salad, and ice cream for dessert. What happens in the U.S.? Literally, all day long. Child, we are destroying and injuring the system.
So
And
this
now we,
destruction of endothelial layer, as you are describing all day long, all the way, if you keep eating this stuff every day, right? So the impacts now, so there was the second part of my question. So let's say that somebody's really severely compromised their endothelial system to a point where, they're at a dangerous juncture in their life. How quickly can it be reversed? How easily and how quickly can it be fixed?
well, when you look at a PET scan, and a PET scan is you're looking at the area of heart muscle that is being normally perfused with blood. And there are some pictures in the book clearly that show a perfusion at baseline when we first see the patient. Normally, if it's being perfused well, it is orange and yellow, and then there's a little patch on the side.
Right. This is this what you're calling? You sometimes described as the widowmaker in the heart, the bottom part. Sometimes
No,
that.
no,
No.
no,
Okay.
no, no. What I'm trying to say is that there is a patch on the PET scan where there is very, very poor perfusion.
Okay.
All right, that's at baseline. Then I counsel the patient. They
Okay.
get it right. And lo and behold, as early as 3 weeks, we begin to see reperfusion of that area.
Wow.
Now, we have not washed out any blockage or plaque, but what happens is you immediately stop, or the perfusion that the end. See, when we first see these patients, the endothelial system is so beaten down that the endothelial system has now become your enemy.
Right. It's
It
working
is
against you. Yeah.
it is now making two molecules called endothelin and thromboxane. And what do? The endothelial system of those two molecules of endothelin and thromboxane, they are vasoconstrictors. All right. Now, that means that once the artery, the three main arteries, widowmaker, the circumflex, right coronary artery,
Mm-hmm.
once they dive into the heart muscle,
Mm-hmm.
you never again see any plaque blocking the artery. That doesn't happen once the artery. But all those small intramuscular arteries are all interdigitated, and they are all thousands of them connected. But when we see those patients, they are all pinched. They have been narrowed by the thromboxane and endothelium. But as soon as
Okay.
you get the patients to stop eating further any of those foods, within the next 3 weeks, that entire intramuscular system that has been pinched and narrowed opens up, and you can see some reperfusion. So that's, to answer your question, that's how rapidly.
Wow.
I mean, where you see it dramatically with patients is if you have a patient who is able to, say, walk 2.5 to 3 blocks, and then they begin to get chest pressure.
So if you see a patient who's going to walk 2.5 blocks with difficulty, is it?
After 2 blocks, they begin to get chest pressure.
Okay.
And suddenly they got on plant-based nutrition. Within days, they can go 3.5 blocks before they get the pressure. Then it's 4.5 blocks. And often you see them literally within 2 weeks, they get rid of their pain. They know that what they're doing is treating their disease.
Wow, wonderful. Karthik, I'm sorry I've been sort of monopolizing the time, partly because of this audio challenge that we're having. But please jump in. I know you have lots of questions for Dr. Esselstyn.
Dr. Esselstyn, one of our audience members is suffering from congenital heart disease. And she's also a vegan now. She's adopted a whole food plant-based diet. Her question to you is that she's trying to avoid invasive testing such as CT angiograms. And what is your advice for her? Like, is there alternative testings that she can do?
Other than the invasive angiogram, is that what you're asking?
Yeah. Yes, correct.
Sure, you can get a non-invasive angiogram. You can get a CT angiogram, though they simply will inject some contrast into your arm and then time it so that when they take the x-ray of your chest, the dye will be going through the arteries to your heart, and they can tell you whether you've got any significant blockages or not.
Great. I think we have more questions from the audience also. No?
I think the real question for your friend there is what are degrees? How sick is the patient?
Okay, we can ask the person the question and then have the answer come back, and maybe we can get that quickly or not.
Yep, she's typing her answer.
Okay, all right. So can we want to take another question in the meantime? We'll come back to that one.
Yeah, she says she's not too sick. I'm not sure what the marker you're looking for, Dr. Esselstyn, is.
Well, it really, you see, there's really, the patient probably may not have to have any tests if they really want to make it as simple as possible. Just simply convert, when they've got a diagnosis of heart disease, immediately convert the whole.
And she's converted already to a plant-based diet, right?
There are real risks to an angiogram. Not often, but you can die getting a invasive angiogram. It happens.
Okay.
Yeah. So I kind of keep that to a minimum. And remember, the real reason for doing an angiogram is just they try to say whether you're going to have to get a stent or whether you have to get bypass surgery. Otherwise, right? They have to see the best.
Right.
But now we know, unless you're in an emergency, I mean, no question, if you're having in the middle of a heart attack, or you have a lot of what we call unstable angina, those patients, there's no question, if they're in the middle of a heart attack, a stent or a bypass can be life-saving. However, many of these people, there is no emergency. Then there is absolutely rock-solid data now that in those situations, when you compare optimal medical diet with stents to optimal medical diet with bypass to optimal medical diet alone, no difference.
No difference. Okay. So Dr. Esselstyn, if you were sort of somebody who just suffered a minor stroke, or has sort of been diagnosed immediately with some kind of hypertension or maybe angina, I mean, the best way to sort of make sure you don't sort of exacerbate it or even reverse it is to go on what you prescribe as a whole food plant-based diet, right? Not pop a whole bunch of pills and take 15 different pills and sort of try to wing this through or put stents in your body and all that, I'm assuming. Is that the recommendation if it's not an emergency situation like you just described?
Yeah.
Okay. It's in some sense as simple as that.
Okay.
I know the diet is not that simple, but it's not a huge medical mystery as to how you would address that issue, is what I'm gathering from what you're saying.
Yeah, in other words, there's been a covenant of trust between the caregiver and the patient since the days of Hippocrates that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in cardiovascular medicine, that is not being done.
Wow.
Sorry, Ravi. I have a couple of questions questions from the audience. So Dr. Esselstyn, obviously there are these new age companies, right, that produce human milk from, cells and things like that. We're culturing cells to produce human milk, etc. Is that healthy for people? Is human milk more healthier? Does it have the same effects that dairy milk has currently?
I wonder if your colleague could repeat your question, because there's something about your microphone
Yeah.
that it makes it very hard for me to understand her questions. But if you
Okay,
could
let me repeat that for you.
question.
Let me repeat the question for you, Doctor. So we've interviewed in the show previously two companies that are actually using cell bioreactors, taking human cells, putting into a bioreactor, and creating human milk for both infants, and they're also looking at a potential adult market for human milk. So instead of obviously dairy, right? We were just wondering whether there were negative health implications from somebody who, in the future, let's say in 2 or 3 years from now, would consume ice cream or butter made of human milk as opposed to cow's milk.
Well, I certainly would love to answer that one way or the other for you, but that's something that would require study. And that's the only way to get the answer. Just to sort of speculate without having it be scrutinized would be not that would not be appropriate.
Okay, so maybe the follow-on question to that is there something? I know you're not you don't like, obviously you don't recommend dairy for people who are trying to sort of obviously avoid getting cardiovascular disease. What is it in dairy? Is it the saturated fat, or is there some other ingredient that makes dairy so bad for people?
Well, saturated fat plus casein.
Casein, okay.
Yeah, the major protein in milk. Yeah, there's a wonderful Harvard study that shows how rapidly injurious the casein can be.
Okay, and so it's a casein as well. It's not just the
Right.
saturated fat.
Right.
And I know you were before this a sort of an expert on expert on breast cancer as well. Is there implications from dairy and breast cancer as well, or is it
Talk
just
about breaking up? I heard it.
hear me as well? Okay,
I heard
let me ask you again.
that.
Is there also a negative impact towards for cancer with milk as well, with dairy?
But certainly that seems to be strongest with prostate. Yeah.
Okay, not so much with breast cancer, I assume.
No, I wouldn't exonerate that. I don't think that's been as carefully studied as it could be, because when you think about it, a number of years ago when I first started this, I did a bit of global research because I was so disenchanted with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim.
Right.
And so I did a bit of global research, and it was quite striking to see that there were multiple cultures where breast cancer rates were 30 and 40 times less frequent than they were in the United States. And that's obviously that was
That was what, Doc?
that was from nutrition.
Yeah. Was from nutrition. Okay. Okay.
Sorry, Labi, we have a question coming in. Perhaps to relate over to Doc. Dr. Esselstyn, can you hear me?
Well, I can right now, but
okay, fantastic. What effects of long-term medication for other problems? Example, medicine for hypertension for 25 years.
And the question was,
what are the effects of long-term medication?
Yeah, if you take for 25 years, yeah, if you take hypertension medicine for 25 years, is there a long-term impact of that?
Well, I think you could probably argue two ways. If you kept your blood pressure in a normal range, there was a benefit from that. But then, of course, you'd have to look what might be the possible side effects of taking the medicine that long. And I don't know of any study that really has looked carefully at that. So I don't think I can say definitively. But my answer really would be for the person to eat in a way that they don't have hypertension.
Sorry, Doctor.
Hypertension, it's interesting that if you look at a developing country, the rate of hypertension is something like 1 to 3%. But if you go to a developing country, suddenly you're up to around 33% of the population will have hypertension.
Is that a factor of maybe not being diagnosed with it, or is that you think it's something else? The discrepancy between developed and undeveloped
No, I think it's because
diet.
yeah, if you look at let's take an example, a country like Micronesia or Nauru.
Okay.
That was a wonderful, historically, that was a wonderfully healthy population, eating sort of a diet of vegetables and fruit. And then of all things to happen, they discovered that there were these incredibly rich deposits of phosphates from millions of birds over thousands of years, just lying on the surface. So there was a great industrial call for this. So in came the carbo chips and tobaccos, and suddenly everybody in Nauru became a millionaire. And millionaires eat meat 5 times a day.
Right.
And suddenly 30% of the population was diabetic, hypertensive, heart disease. It was just a classic example of how this Western diet can destroy you. So,
and I think you've cited a similar study from World War II. I remember from Norway or Sweden, right, where you see the incidences of heart disease just plummet, and as soon as the war is over, it starts climbing because meat becomes more available.
Right.
So there is plenty of empirical evidence to suggest that there is a strong, if not definitive, correlation between diet and heart disease.
Yeah.
Ravi, I have a question if doctor can hear me. So doc, if somebody is already on a whole food plant-based diet, right, but lack sleep, have lots of stress in their life, and drink a lot of caffeine, how does that impact their cholesterol?
Did you get that, doctor?
Not a bit.
Okay, so let me just try and repeat it for some reason. So let's say that somebody's been very good and has been following your diet strenuously and to the letter. However, they are under stress because of a personal situation. Maybe they're not getting much sleep for some reason, and maybe they're breaking their diet a little bit by having a little bit of coffee here and there. Would that drive their cholesterol up, and would that also cause them to have issues with cardiovascular disease?
No, I think if they're eating a whole food plant-based nutrition, and they happen to have some stressful issues, that's not going to. In my information, that's not going to injure the endothelial cell.
Okay. So doctor, so is this emphasis on sort of cholesterol, which seems to be been the gold standard for a long time, where people sort of take a cholesterol test and then decide that somehow you have to manage the cholesterol? Is that the real key here, or is it managing the endothelial cells and inflammation the right way to look at it?
Yeah, I think increasingly, I think inflammation is important. Remember, every single one of us has to have, and we make cholesterol.
Right.
Even if you're not eating a single molecule of cholesterol, your liver is going to make the cholesterol that your body needs.
Right.
Now, if you take 1,000 patients who may absolutely perfectly follow whole food plant-based nutrition, there will be some who will have a total cholesterol level of 102. Some will be 140, 160, 180, 200, 220. That's their thermostat.
That's thermostat.
Their liver now.
Right.
The important thing is, as long as you're eating whole food plant-based nutrition, you should be able to make yourself an endothelial fortress. Your endothelial fortress. So even if you have a few extra molecules of cholesterol coursing through your bloodstream, if there is not a crack, a fissure, an opening in the endothelial cells, then this cholesterol should not be able to hurt you.
Okay, so that's the key, really. Then it's not the focus on the cholesterol; it's a focus on this beneficial gas that's coursing through your arteries, and preserving that or enhancing that. So, is there a way to? I mean, other than a whole food plant-based diet, is there any other way? I mean, there's no pill you can take. I'm assuming there's no other way to sort of increase or build this fortress other than through diet, right? Is that
Well, probably in the future there may be somebody who stumbles upon a pill or medication that can help, but I think it's easier to look at it the way nature has established it. Whenever whoever the jolly maker was that divined the human body in the first place did not have in mind an organ right up the quadrant of the abdomen called the liver.
did not have in mind an organ?
Pardon?
He said the person who designed the body didn't have in mind the organ. Sorry, you broke up after that.
Yeah, didn't have the organ in the right upper quadrant of the abdomen, the liver, which
Okay.
is not designed to make enough cholesterol to destroy your arteries and fill them up with plaque.
Right.
Yeah.
Right.
It's got right, because look, every single cell membrane in our body is made of cholesterol as the basis of our sex hormones, the basis of vitamin D. Yeah, cholesterol is essential, but we've got to eat in a way that we can respect the integrity of the endothelial system.
So talking about sex here a little bit, just to try to digress and maybe get a lot more people to pay attention. I know that there is a direct link, your penile artery and sort of your heart health, right? So if you have problems with erectile dysfunction, you most likely will have some issue with your cardiovascular health. Am I correct?
Sounds good.
Okay. So the answer for that is not Viagra or any of the other pills that's out there. It's the same prescription that you've been writing for everything else.
Yeah, there's a slide in my presentation that discusses that. Yes, it's really erectile dysfunction is the canary in the coal mine.
Okay.
Because function, you also probably have the beginning of cardiovascular disease. Yes.
Okay. Kartika?
Wow.
Yeah.
We're-
Hi,
No, we're all here. We're still here.
we're still here.
Okay.
Ravi, if you can relay back to Doc because he can't seem to hear me. Can alcohol be part of a whole food plant-based diet?
Yeah, we get asked this all the time when people talk about what we eat. So is alcohol a part of a whole food plant-based diet? In moderation, I'm assuming.
Well, alcohol is a toxin. It's toxic to the brain, it's toxic to the heart, it's toxic to the liver. But if you want to have a glass of wine on Friday or Saturday night, I think that's fine.
So we've been talking about this whole food plant-based diet, which is your prescription. It will be helpful for our audience, Doctor, if you could just briefly sort of say what's in it and what's not in it, sort of thing, or what's in it.
Yeah, good. Yeah, what are the foods that every time they pass our lips, we injure the endothelial cells? They are.
Correct. Yeah.
1, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil.
So this oil, whether it's cold pressed or processed or not, doesn't matter. It's oil. It's a no-no. Correct. Okay.
Also, anything with a mother or a face, meat, fish, chicken, fowl, turkey, and eggs. And also anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt. And we like
Ice cream and yogurt. What else?
what's that?
You said ice cream and yogurt, and then after that, what else is not included? You said, is it nuts?
Sugary drinks, diet colas.
Okay, sugary drinks. Okay.
And sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey for patients who have heart disease. Not peanut butter, nut butters, or cashew sauce, or avocado. And finally,
so is maple syrup okay, or is that also a no-no?
Well, there are going to be a couple of recipes for desserts in our book that has maple syrup. But if the patient has heart disease, I would just assume they didn't have, because sugar will injure the endothelial cell.
Oh, sugar does that. Okay. Okay.
And finally, coffee with caffeine. Decaf, yes. Coffee with caffeine injures endothelial cells.
Okay, so now now the impact of the prescription, I think, is sinking into a lot of people. So we have a question for you, doctor. I mean,
Now,
how do you empathetically?
Do you want to know what foods we want you to eat?
Yes,
Okay,
please.
let's do that, and then let's come back to the question I want to ask you. Yes, please, go ahead.
We want you to eat all these marvelous whole grains, WHOLE, whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, and beans. All these marvelous red, yellow, and green leafy vegetables, and white potatoes, and sweet potatoes, and some fruit. There
Fruit.
you go.
Okay. Okay.
Now
So
there
then,
is one thing that we've just added
okay. What was that?
in the last 10 years, because remember what we've been talking about is the endothelial production of nitric oxide, and that is age dependent. So if you're beautifully healthy at age 20, at age 50, if you're beautifully healthy, you now have 50%.
You now have 40%.
No, 50%.
Okay.
Of the nitric oxide that you had when you were age 25. Now, when you're over 80, you've lost over 70% of the endothelial production of nitric oxide.
Okay.
So we really, the last thing.
Sorry, the last.
In the last 10 years.
Okay.
Is a way of taking advantage of the research in the last 12 or 14 years that has shown that there is an alternate path.
Sorry, doctor. What was the alternate pathway?
Well, I'm just going to describe it.
Okay.
That there in the last 12 or 14 years, there has been described an alternate pathway by which humans can make additional.
So the way, sorry, doctor, you just cut off again. So the way humans make, I think that's where we lost you there again. Sorry.
Yeah, the way humans can make additional nitric oxide.
Okay, which is?
If I can get patients to chew. To chew 6 times, not smoothies, not juicing.
Okay.
If I get them to chew a green leafy vegetable 6 times a day, roughly the size of half your fist.
Half the fist, okay.
After it has first been boiled in water, 5.5 to 6 minutes, and so it's now nice and tender. Then you must anoint it with several drops of a delightful either rice or balsamic vinegar.
Rice or balsamic vinegar. So you're talking about
because the acetic acid from those research has shown that the acetic acid from those vinegars has been able to restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again your lunch and sandwich. That's 3, mid-afternoon, 4, dinner time, 5, and of course adherent kale number 6. Now, the second benefit of ingredients is it restores the capacity of your bone marrow. Once again, make the endothelial progenitor cell. What do they do? The endothelial progenitor cell.
Sorry, Doc. Again, I think we've lost your audio again. So, if you keep chewing this, you said 5 to 6 times a day. Was that correct? The number?
6 times a day.
6 to?
6 times a day.
6 times a day. So half a fistful of these vegetables. So can it be? It has to be leafy green vegetables, or it can be broccoli and Brussels sprouts and things like that. Or is there
I'll tell you in a minute.
Okay. All right. Yeah. Please.
Shall I start again on the green leafy vegetable, or what? How much of that did you get?
Just the quantum, the frequency is where we lost you there, and what the content of the actual the thing that you boil and soften.
we've
With
agreed.
you said balsamic and rice vinegar, so that far we got.
It's hard to know where to sign.
No, so
All right, here we go.
Okay.
I want them to chew a green leafy vegetable, roughly the size of half of their fist.
Okay.
I want them to chew that 6 times a day after it has first been boiled in water 5.5 to 6 minutes or steamed till it's now nice and tender. And then you must anoint with several drops of balsamic or vinegar, because research has shown that the acetic acid from those vinegars
Releases this, right?
will restore the nitric oxide synthase enzyme,
Okay.
which is contained within the endothelial cell and responsible for making nitric oxide.
Okay.
So you're going to chew this, therefore, alongside your breakfast cereal. Again, as mid-morning snack. Again, with your lunch and sandwich, that's 3.
Okay.
Mid-afternoon, 4.
4.
Dinner time, 5. And of course, I adore it when you have that evening snack of kale.
Oh,
Now, the second benefit.
Okay.
The second benefit is chewing the greens will restore the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? The endothelial progenitor cell will replace your senescent, injured, worn out endothelial cells. And
so it replaces these worn out cells. And what is the third benefit, Doc? So this replaces your worn out cells?
The endothelial progenitor cell will restore, helps to replace your senescent, worn out, injured endothelial cells.
Okay.
And the third thing, and the most important of all,
okay,
the endothelial cell, correction, when you are chewing the green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue.
Okay.
Those bacteria are going to reduce the green nitrate that you are chewing to a green nitrite.
Nitrite,
Now when you swallow the nitrite, it is your own gastric acid, which will further reduce the nitrite, which can enter your nitric oxide pool.
Okay.
So think about it. For no significant expense, no side effects.
Right.
From dawn to dusk, all day long, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place.
Right.
Now, there is a caveat.
Okay.
Toothpaste with fluoride, public drinking water with fluoride, or mouthwash will injure the beneficial bacteria in your mouth. And we do like you to avoid antacids, because antacids will reduce your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide.
Okay. So while you're going through this regime, you strongly recommend no fluoridated water and no toothpaste with fluoride in it. Drink the good old normal stuff, and that'll help keep this regime on a positive note. Doctor, you there?
Well, you broke up pretty badly there.
Okay, sorry. I think stay off the fluoride, and it'll help the whole process through, right? So that's a negative.
Now, what are the green leafy vegetables I'm talking about? Bok choy, Swiss chard, kale, collard greens, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, asparagus,
Swiss chard, okay.
Arugula, beet greens, and beets. And look what it does for your memory.
Well, Dr. Esselstyn, you're definitely a living proof of your own medicine. I don't think we can say that about most of our doctors. I always hate the fact when my doctor tells me I need to lose weight. I look at him or her, and they certainly haven't been taking the prescription that they're giving me. So I always appreciate advice from doctors that follow their own advice. So we put the list of greens up on up here so that people can actually see it as well. So this whole controversy around salt. Let me just make this sort of our last question. Is salt good, bad? I mean, if you're eating all of these pulses and leaves, you would need some salt, or there's a question about salt increasing hypertension and all that. Is that true? Not true?
Well, none of our recipes. See, if you can get so much salt when you add it when you're cooking. So
Okay.
we think it's important not to cook. And if you are desperate for some tip, if your food seems too flat, if you just take a salt shaker
Mhm.
and sprinkle it lightly, or use some lemon or lime, whatever,
Okay.
up the taste. But I don't think you want to load up with salt.
Okay.
The ideal level is about 1,500 milligrams.
1,500 milligrams of salt.
Yeah.
Okay. Karthika, we're at about the hour time. I don't want to take too much of Dr. Esselstyn's valuable time. Any more sort of last questions from you or the audience?
No, Lavi, we covered everything, and also I've been sort of transcribing what doctor's saying and sharing with the different people.
Okay, good. I know the audio has been a little bit of a challenge today, so I'm glad you did that, Karthik, and I did monopolize the question time. Normally we divvy up this pretty well between the two of us, so thank you for helping manage the guests on the show. Dr. Esselstyn, we are very grateful that you've sort of graced our program and given our viewers who are mainly from South Asia, but we're a global operation. We got listeners listening in from all over the world. But I wanted to make sure that people have the benefit in this part of the world have the benefit of your good counsel and advice as well. As it is January and everybody seems to be looking at their diets anew, and the pandemic has also focused a lot of attention on health and what you put in your body for immunity purposes. We felt it was sort of a timely a segment to have someone like of your stature on the show to guide people on what has been sort of a neglected area in medicine. So we're very grateful that you were able to lend your considerable expertise on this subject to our worldwide audience today. So thank you very much for doing that.
Bye-bye.
Bye. Thank you very much, Doctor.